Very good morning, everyone. I'm Dr. Shruti Bajaj, Director and Consultant Clinical Geneticist at the Purple Gene Clinic, Mumbai. Today, we will try and understand about one of the tests which deals in preventive genetics. It is called as carrier screening. A carrier is an individual who carries one mutated or a variant copy of a particular gene while the other copy is normal. Such a carrier typically remains healthy or asymptomatic because the other copy of the gene is functioning well. It is estimated that humans are carriers for nearly 5 to 6 conditions, at least. Husband and wife are carriers, you can see in this slide. In certain couples, they could be carriers for the same disease. And in such a scenario, there could be a 25% chance of a child inheriting the faulty copy of the gene from each parent and thus manifesting the disease, even though there is no significant family history of the condition sometimes. Carrier screening is a test which is thus offered to healthy partners to know their risk of having a child affected with genetic diseases. These tests are ideally best conducted prior to conceiving a baby. This is because knowing that both the partners are carrying an error in the same gene, certain tests can be offered to the couple while the lady is pregnant in order to know the risk of the fetus inside being affected. Some couples may opt to discontinue the pregnancy if the child is found to be affected with a serious genetic disorder. Alternatively, this knowledge can also be used to conceive a baby via IVF and screen the embryos prior to implantation by a process called as pre-implantation genetic diagnosis. In this process, the healthy embryos that do not carry the faulty gene combination are selected and implanted into the mother's womb. Amongst these, I would want to stress upon beta thalassemia and spinal muscular atrophy. Beta thalassemia, as we can see, is one of the commonest genetic disorders in the world, specifically in Asia and in India. It is a blood-related condition, chronic, lifelong disorder requiring frequent blood transfusions, potentially associated with a lot of morbidity. Although treatable by bone marrow transplant, this may not always be an easy option. Hemoglobin electrophoresis is an inexpensive, readily available test which can be easily implemented by testing either of the partners to look for the carrier status for beta thalassemia or sickle cell disease. If one partner is found to be affected, then the other partner is tested too. Prenatal and preconception carrier screening for thalassemia has been successfully implemented for the past many years by the Government of India as well as many non-government driven programs across the country. Coming to spinal muscular atrophy. Spinal muscular atrophy is the commonest genetic cause of death of a child within infancy. The child, if born with this condition, has floppiness or along with muscular paralysis, difficulty in breathing, often needing a ventilator. Children with SMA don't usually make it beyond their first birthday. As per recent Indian data published from North India, led by the team by Dr. Shubha Phadke, the carrier frequency for SMA is 1 in 38. Yes, 1 in 38. So 1 in 38 individuals could be carrying an error in one of the SMA genes and not being aware of it. Given this relatively high carrier rate and the disease severity, American College of Medical Genetics and Genomics, along with the American College of Obstetricians and Gynecologists, recommend universal screening for spinal muscular atrophy in every couple. The same has been made mandatory recently by the government of Turkey too. Although there is no such formal guidelines in place by the Indian bodies, we can extrapolate these figures for the benefit of the Indian population too. It is important to remember that while carrier screening has strengths, it also has certain limitations. For example, MLPA for SME, which detects the carrier status for spinal muscular atrophy, can detect just 95 to 98% of the carriers. Thus, in other words, complete assurance of non-carrier state cannot always be given despite normal results. These tests can sometimes be expensive. However, here I would like to give a bit of a trivia. The cost for SMA carrier testing is 6,000 to 10,000 Indian rupees, whereas the cost for treating spinal muscular atrophy by gene therapy by a single injection costs 16 crore rupees. So while the cost may be prohibitive, the cost-benefit ratio of screening versus treatment is definitely encouraging towards recommending a universal screening for SMA to all couples. Coming to some of the other disadvantages when there are expanded carrier screening tests, that is tests which screen more than hundreds of genes together. Sometimes there may be unwanted, uncertain, or inactionable results that may pop up and may cause a lot of anxiety to the couples. So I would like to summarize. Consider carrier screening for these two disorders, that is hemoglobin electrophoresis for thalassemia and MLPA for SMA, as your absolute basic and bare minimum seatbelt when you get onto the journey of planning your baby. Because these tests have the potential to prevent the unexpected birth of a child that's affected with these morbid diseases. There are more extensive screening panels, which I think is beyond the scope of today's session. I would love to hear from you. I hope this video was useful to you all. Thank you so much.